Now and again, everybody needs a little help. If you have diabetes, you may be feeling kind of overwhelmed. Oh, I know I sure did. Luckily, I found the information I needed and discovered that it wasn't difficult to take control. You will too. Hi, I'm Joanna, and I'm here to help you get started. I was diagnosed with type 2 diabetes 4 years ago. It took me some time to face the fact I have to pay attention to what I eat. The thing is, no matter how you're controlling your diabetes, whether it's by diet and exercise, diabetes pills, or with insulin, food has a huge effect on diabetes control. The upside is that you have a lot of control over your diabetes. So let's get started. Diabetes means that your blood glucose is too high. Just so you know, blood glucose is also called blood sugar. And glucose comes from the food you eat. Blood carries the glucose to all the cells in your body where it's used for energy. Glucose that doesn't get moved to the cells stays in your blood. And too much glucose in your blood isn't good for your health. Diabetes also involves insulin. Insulin is a hormone that's made in your pancreas. It sends a signal to take the glucose from your blood and move it to your cells. With diabetes, you don't have enough insulin, or the insulin you make doesn't get the glucose from the blood to the cells. Either way, glucose builds up in the blood. So let's recap. Blood carries glucose to the cells. Insulin signals glucose to move from the blood to the cells. With diabetes, too little insulin, or the way it works, results in too much glucose in the blood, and that's not healthy. Now here's the deal. In type 1 diabetes, the pancreas has stopped making insulin, so people with type 1 diabetes have to inject insulin. Type 2 diabetes is different. Even though the body is making insulin, not enough glucose is moved from the blood to the cells. This is called insulin resistance. Insulin resistance can sometimes get worse with time. The pancreas may also start to have problems making insulin. When this happens, people with type 2 diabetes need to inject insulin to have better control. But here's the good news. Making adjustments to the diet and getting enough exercise have been shown to improve the way insulin works and even improve insulin resistance. Hey, you know what? I'm going to the doctor's right now. Why not tag along? I'm going to get my A1C test done. An A1C test shows your doctor how well your diabetes has been controlled over the past 2 to 3 months. It measures the average amount of glucose in your blood. Your A1C result is directly linked to how your blood glucose levels change throughout the day. But you know what? We'll talk more about that later. Here's Dr. Travers. He's a primary care physician. Doc, can you talk about what an A1C result means?
Sure, Joanna. People without diabetes have an A1C in the range of 4 to 6%. Diabetes specialists agree that most people with diabetes should aim for an A1C of 6.5% or less. Now, an A1C result over 6.5 tells me you often have high blood glucose. If you've just been diagnosed, it may take some time to reach your A1C goal. But that's okay. You can get there. The goal of all diabetes treatment is to keep your blood glucose levels in a healthy range, not too high and not too low. I ask patients like Joanna to test with a blood glucose meter so they can see what happens to their glucose levels day to day. And Joanna, your latest results make me think that testing has helped you make some positive changes.
I had a 9 A1C when I was first diagnosed, but it's getting better, slowly but surely. So I can show you some good first steps. Did you know your blood glucose levels change throughout the day? Your blood glucose is affected by food, exercise, medications, and even by your emotions, like if you're overstressed. Hey, Doc Travers just told me that my A1C is 7.2. Remember I said it used to be a 9? It's getting better since I started testing with my OneTouch Ultra 2 meter and acting on the results. That's what I want to talk about next. Let's go back to my house. Did you get all that? An A1C is a lab test that measures the average percent of glucose in your blood over the last 2 to 3 months. Most people with diabetes should aim for a result of 6.5% or less. Your blood glucose level changes during the day because it's affected by food and exercise, medication, and emotions like stress. A great way to start to understand how things like food and exercise affect your blood glucose day to day is by testing with your OneTouch Ultra 2 meter. Your doctor will tell you when you should test. It's really easy. See? That's all it takes. Your results will look like this. In general, your blood glucose should be lowest when you first wake up, before you eat breakfast. This is called your fasting blood glucose level. You see, after you finish eating dinner, your body uses up a lot of glucose during the evening and while you sleep. When you have diabetes, your fasting blood glucose should be 110 milligrams per deciliter or less. All this talk is making me hungry. When you have a meal, and for 3 to 4 hours afterward, your blood glucose levels will be higher than your fasting glucose. 2 hours after you eat, a test result of 140 or lower is considered a healthy result for most people with diabetes. Your doctor will tell you what your goal should be. Remember the A1C test I got? My result was 7.2%. Here's how average blood glucose levels compare to the A1C results your physician uses. Right now you might be saying to yourself, yikes, this seems like a lot of numbers and things to remember. But it really is easy once you start testing. And there's a very important reason to test and keep testing regularly. You see, medical science has shown that high blood glucose levels over time can damage blood vessel walls, and that can lead to serious diseases like heart disease, blindness, and kidney failure. What's more, diabetes has been linked to other complications like nerve damage, which can lead to amputation. Regular glucose testing is the best way to know if you're keeping your glucose in range, so pay attention because I want you to stay healthy. Let's review. It's important to keep your blood glucose in range because high glucose levels can damage blood vessels and can lead to serious diseases. Regular testing with your OneTouch Ultra 2 meter and acting on the results can help you reduce the risk of complications. Here are some general glucose targets. Testing before breakfast gives you a fasting result. It should be 110 milligrams per deciliter or less. 2 hours after the beginning of a meal, aim for 140 milligrams per deciliter or less. Talk to your physician to see if these blood glucose goals are right for you. Testing with your OneTouch Ultra 2 meter is a simple way to see what your blood glucose level is at different times of the day. And the best part is that your results can help you figure out what to do to help keep your blood glucose in range. I kind of think of my blood glucose meter like a speedometer. I mean, think what it would be like to drive without a speedometer. How would you know if you're going over the speed limit? That's how I feel about my meter. It shows me if I'm going the right speed. With the OneTouch Ultra 2 meter, you can test anytime, anywhere. It's so easy to use and gives me results in just 5 seconds. I especially like the way it helps me manage my glucose around meals, too. It lets me mark my results as before or after meals, then look back at the averages screen to see how I'm doing. Averages help me see if my results are generally where they should be, and the effects of any changes I might be making. For instance, lately, I've been having fewer carbs at breakfast. See how my after-meal averages for 7 days are lower than my 30-day averages? That shows me my choices are working to bring my glucose into range. Hey, look at the time. Think I'll go for lunch. Let's review. Testing at different times of day helps you understand how things like food and exercise affect your glucose. Reviewing results can show you what's working and what's not. Your OneTouch Ultra 2 meter gives you before and after meal averages. That can help you see how your food and portion choices over time affect your glucose. Of all the things that make blood glucose rise, food has the biggest effect. Different foods can raise your blood glucose more than others, and portion size plays a big part too. Another reason food is important is because it's one thing you have control over. That means a lot when you have diabetes. And you know what I've learned? Having diabetes doesn't mean you have to give up the food you love. It starts with making simple choices.
Hi, honey. Having the special? It's our 3-cheese macaroni with a side of garlic bread.
No, I'll have the number 3 spaghetti with meatball salad combo, please. Last time I had the macaroni special, my blood glucose went sky high. I found out that less carbs and more fresh veggies help me stay in range. Before I eat, I test to see what my glucose level is. 120 milligrams per deciliter, and I flag it as before meal with the up button. Easy, right? Now take a look at my before meal average screen. See? It includes the test I just took and all my before meal results from the last month. Before meal averages show me if I'm generally at a good range before I start eating. Hey, if your blood glucose is